So here's one that I get all the time. Dr. Robertson, my dentist says that I need a deep cleaning, but another office mentioned LANAP. Aren't they basically the same? Spoiler alert, they are not. Both LANAP and deep cleaning share the same goal, which is to reduce the inflammation, to remove the infection, and to get rid of the bacterial environment so that the gums can actually heal. They just go about it in very different ways. In this video, I'm going to look at exactly how LANAP and deep cleanings differ, so you can understand what each one does and which one might actually help your gums heal. So let's start with the deep cleaning, or what we call scaling root planing, or SRP for short. During SRP, your hygienist or your dentist will numb the area and use really fine instruments called scalers to remove the plaque, the tartar, and the bacteria below the gum line. It's great for early to moderate gum disease because it's physically removing the buildup that your toothbrush cannot reach. Here's what's happening in your mouth before that. Plaque, that soft sticky film that builds up after you eat or drink something, well, it's made up of bacteria, food particles, and saliva. And if it's not removed with thorough brushing and flossing, the minerals in your saliva, mainly calcium and phosphate, they combine with the plaque and they harden it into tartar. That hardened buildup attaches to the teeth and the roots, especially along the gum line where the saliva tends to pool. Once that tartar forms, it acts like Velcro and it traps even more bacteria. The gum line then starts to weaken and becomes inflamed, and that inflammation causes the gums to swell and pull slightly away from the tooth. That little separation can form a pocket, and now the bacteria can slide right underneath the gum line, kind of like unzipping a jacket and letting in the cold. The deeper the pocket gets, the more bacteria that move in, and the harder it is on your body to fight that infection on its own. That's where scaling and root planing comes in, to physically break up and remove the tartar and bacteria below the gum surface. But here's what most people don't realize. Those scalers are only designed to safely reach about 4 to 5 millimeters underneath the gum tissue. That's about the depth of an early periodontal pocket. If the pocket goes deeper than that, 6, 7, sometimes even 10 millimeters, the tip of that instrument simply can't even reach all the way to the base of the infection without really risking damage to the root or the healthy tissue. So the deepest part of the pocket, where the most aggressive bacteria live, is actually left behind. That's why we sometimes say scaling and root planing is a surface treatment for a deeper problem. It only helps control inflammation at shallower depths, but once the disease becomes advanced, the bacteria hide in areas that instruments just simply cannot access. Now, LANAP, which stands for Laser Assisted New Attachment Procedure, works completely different. Instead of using metal instruments to scrape the root, we simply use a hair-thin laser fiber that slides between the tooth and the gum. The light energy in that laser specifically targets the diseased tissue that are breaking down the gum tissue. It simply vaporizes those bacteria and removes the diseased tissue, but leaves your healthy tissue completely untouched. The laser then sterilizes the area and triggers your body's own natural responses to actually heal itself. It forms a blood clot that seals around the pocket and encourages your gum tissue to reattach to your tooth. Think of it this way. A deep cleaning is like washing the outside of a wound. LANAP is like disinfecting the inside of the wound and helping it actually close. Another big difference is comfort and recovery. After scaling and root planing, you may feel soreness for a day or two. After LANAP, most patients describe the area as feeling bruised for about 48 hours. But there are no incisions, no stitches, and no open wounds. Most people go back to work or resume their normal activities the very next day. Now let's talk about when each one is appropriate, because both have a place in periodontal care. Scaling and root planing works beautifully when gum pockets are generally 4 to 5 millimeters or less. At that depth, instruments can clean the root surface effectively, and your gums can tighten back up once the inflammation is reduced. But when pockets are deeper than about 5 millimeters, especially when there's bleeding, there's bone loss, or there's mobility, SRP simply can't reach the base of that infection. There's also research showing that aggressive scaling in deeper pockets can actually remove too much of the root surface and actually delay your healing. That's when LANAP actually becomes the more predictable option. The laser energy goes down inside the pocket, kills the bacteria at the base, and it actually promotes regeneration and reattachment of the tissue to the tooth. LANAP is also unique because it's tissue selective. It can determine the difference between infected tissue and healthy tissue. That means we're only removing what's diseased, but we preserve as much of the healthy tissue as possible. And preserving that tissue really does matter. It keeps the gums from receding and protects the appearance of your smile. Another difference most patients don't think about is the long-term stability. After a deep cleaning, if you can maintain your excellent home care and your regular hygiene visits, you can keep things stable, but you'll still need to be closely monitored. With LANAP, we're not just maintaining and monitoring, but we're also rebuilding. Most patients see a measurable reduction in pocket depth, even signs of bone regeneration over time after having the LANAP procedure. Here's a simple rule of thumb. If your pockets are 4 to 5 millimeters, a deep cleaning is the right, most conservative next step. But if your pockets are 6 millimeters or deeper, or you've already lost bone support, LANAP is actually the better option because we're not just cleaning, we're helping rebuild and heal your gums. So when someone says, oh, the laser's just a fancy cleaning, that's not true. LANAP is a research-based surgical protocol that actually helps your body regenerate what your gum disease has destroyed. It's not hype, it's science backed by healing. If you're in the Dallas-Fort Worth area and you've been told you need a deep cleaning, but you still have bleeding or bone loss, let's talk. We'll evaluate your gums, we'll measure your pockets, and we'll decide which treatment is best for your specific case. Whether it's scaling and root planing or LANAP, our goal is actually the same: to help you keep your teeth, preserve your smile, and protect your overall health. Thanks for watching, and remember, healthy gums don't just happen, they're built by stopping infection and choosing the treatment that actually helps your body heal. Vaporizes those bacteria and removes the diseased tissue while leaving the healthy Ah!
That's okay.
Okay.
That's the one you consider for real? Bring it back a little bit more, or it's good to go?
Okay. The light energy in that